AAMG is dedicated to provide the highest quality multi-specialty medical services to patients in the San Francisco Bay Area. Come sign up to be a member today. AAMG. Your choice, your health, our mission.
Hello, I'm Dr. Schuman Tam. I'm an allergy, asthma, and immunology specialist practicing in the San Francisco area in the Marin County. And it is my pleasure to be able to discuss with you some basic medical knowledge regarding asthma. So what we're going to talk about today is we'd like to talk about asthma. What is asthma? Symptoms of asthma, how the physician usually manage asthma. And then finally, we will talk about asthma, diet, and obesity. This slide shows what asthma is like. On the right-hand corner, you will see a cartoon of a normal patient's bronchial tube, which is widely open without inflammation, and air can go flow through it without any trouble. Patient with asthma will have a bronchial tube like this on the right side, showing swelling of the airway, inflammation of the airway, and constriction of the airway. When the airway is constricted, patient will have problem getting air through into the lung. If they cannot do that, the patient will have shortness of breath sensation. When you constrict even more, the patient will have a severe shortness of breath, and if you plug up completely, the patient can suffocate, and it can kill a patient with asthma. So asthma is a serious medical condition that can cause death. Asthma is very common, more common in children than in adults. Statistics show that 3 out of 10 kids will have asthma, somewhere from age infancy to age 6, usually associated with when they have a upper respiratory tract infection. Usually these children will grow out of the asthma by age 6, even when they have a cold. However, if these kids develop allergy, like environmental allergy like dust, pollen, or animals allergy, the asthma might persist into adulthood, because not only common cold can aggravate asthma, environmental allergy can make the asthma persist. So how common is asthma? The statistics show that about 1 out of 10 people in the United States have asthma. It translates to about 30 million people in the United States have the condition. So this is asthma not only is a serious condition that can cause death and disability, it is also a very common condition. This slide shows the common symptoms of asthma. Frequently, patients might have wheezing, basically because of a constriction of the airway. Some patients might have cough only because of inflammation in the airway, as I shown in the cartoon previously. And also the airway might be filled with mucus, and that can make the patient have an urge to cough. Now, some patients can have cough only without any wheezing. So chronic cough, asthma can also be a cause for chronic cough. When the airway is more constricted, the patient will have shortness of breath, and if it gets worse, the patient has chest tightness. So those are the frequent symptoms of asthma. The patient might have only one symptoms only. This slide shows some of the cause for asthma. Allergy is a common cause for asthma. For example, cat and dog danders can cause asthma. Dust mite can cause asthma. Sometimes, depending on pollen count, it might cause asthma. Right now, we have grass pollen, and grass pollination can also cause asthma if the count is high. Sometimes mold can also cause asthma too. There are other factors that can cause asthma. Pollution is another one. If you live close by to a freeway and with exposure to car exhaust, or if you live close by to factory, you might be exposed to pollution. That can also cause asthma. Some patients have exercise-induced asthma only. Some patients have emotional-induced asthma. Cigarette smoke, of course, can cause asthma. And if one do not stop smoking, one can develop emphysema in the future, a more severe form of respiratory disorders. Sometimes cold air can cause asthma. Sometimes a viral infection can cause asthma. So the list is very long. Sometimes reflux, many cause. Sometimes patients might have asthma symptoms, but might not be actually asthma too. So it is, again, very important to be seen by your primary doctor to make sure that you have the correct diagnosis and also to identify the cause for asthma.
For more information on other health topics, please visit the AAMG Health Education website. If you like this video, please give a like, and subscribe to our channel for more related content.